Does your mind always stay sad, even if there is a happy environment in your life? Does your mind always stay gloomy, and because of this, your daily life tasks get greatly affected? Today, we will understand what depression or mental sadness is. We will cover it very deeply in this video, such as how many types are there, what are its symptoms, how depression affects the brain, and what treatment options are available. Let's start and understand all these things one by one. Depression is a mood disorder that causes continuous feelings of sadness and loss of interest. It is also called major depressive disorder or clinical depression. It affects how we think, feel, and behave, and it can lead to a variety of emotional and physical problems. It can make everyday activities difficult, and sometimes you may feel that life is not worth living. Now you may think, that is it all about depression? Yes, friends, it is, but it is not as easy as it looks or sounds. Now let's see how depression affects the brain. We have divided it into 4 parts. First, biological differences. Second, brain chemistry. Third, hormonal changes. Fourth, inherited traits. Hearing all these words, you might be a little confused about what this is, but don't worry. We have explained it very simply with examples. Let's first look at biological differences. Depressed people's brains show some physical changes, especially in the hippocampus area. Let's understand this with an example. As seen in MRI scans, the hippocampus area of the brain in depressed people shows shrinkage. Now you might ask, what is hippocampus? Hippocampus. It is the part that controls memory and emotion. This shrinkage is seen in severe cases of depression. Now let's see the second, brain chemistry. Neurotransmitters like serotonin and dopamine are naturally occurring brain chemicals that help regulate mood. In depression, their balance gets disturbed, which adversely affects mood and thinking. Serotonin and dopamine affect the areas of the brain that control emotions and the reward system. Let's understand this with an example. If a person's serotonin level decreases, they may feel sadness and anxiety. A low level of serotonin directly affects mood and emotional stability. Similarly, if the dopamine level decreases, they may feel a lack of motivation and pleasure. A low level of dopamine is often associated with reward-seeking behavior and anhedonia, meaning difficulty in feeling joy and pleasure. Now let's see the third, hormonal changes. Hormonal changes like pregnancy, thyroid problems, menopause, and other conditions can trigger depression. For instance, some women feel postpartum depression after pregnancy. This happens due to hormonal changes in the body after delivery. This hormonal imbalance can adversely affect mood and thinking. Now lastly, let's see the fourth, inherited traits. If someone in the family has depression, other members are also at risk. Genetic factors can also be a reason for depression. For instance, if someone's parents or siblings have had depression, they are at a higher risk of getting depression too. Genetic predisposition means the chances of getting depression are higher based on family history. These were some major reasons why depression can affect the brain and change your life. I hope you have understood it well, so please like and share this video with your friends and relatives. Now let's move on and understand how many types of depression there are. There are many types of depression, out of which we will understand some common ones one by one with examples. First, we have major depressive disorder, MDD. This is the most common type of depression which causes continuous feelings of sadness and loss of interest. Its symptoms are more intense and of longer duration. Let's understand this with an example. Look at Ravi, a successful businessman who has been feeling extreme sadness for the past 6 months. He has lost interest in his work and hobbies. This could be a sign of major depressive disorder. If you want to fully understand major depressive disorder, MDD, you can click here on the I button or find it in the description box. Now let's understand the second type, persistent depressive disorder, PDD. It is also called dysthymia. It is a chronic form of depression that lasts for 2 years or more. The symptoms are milder than MDD but long-term. Like Aisha, a school teacher, who has been feeling mild sadness and lack of energy for the past 3 years. Her symptoms are not severe but persistent. This could be a sign of persistent depressive disorder. Now let's understand the third type, bipolar disorder. In this, mood swings occur where a person feels extreme highs, mania, and extreme lows, depression. For instance, David, a college student, sometimes feels very energetic and happy, mania, and sometimes feels very sad and hopeless, depression. This could be a sign of bipolar disorder. We have already made a dedicated video on bipolar disorder. You can check it out by clicking on the I button or in the description box. Now let's understand the fourth type, postpartum depression. This depression is especially found in new mothers, usually after delivery. Its symptoms include sadness, fatigue, and lack of purpose. Look at this example. Ava, who is a new mother, is feeling extreme sadness and fatigue after delivery. She's not even interested in her new baby. This could be a sign of postpartum depression. Now let's understand the fifth type, seasonal affective disorder. Seasonal affective disorder occurs with the change of seasons, starting and ending at the same time every year. For most people, sad symptoms begin in the fall and continue through the winter months. It reduces energy and spoils mood. For example, look at William, who is usually a happy person, feels sad and lethargic as soon as winter months arrive. This could be a sign of seasonal affective disorder. We have also made a dedicated video on this. You can check it out by clicking on the I button or in the description box. Now let's understand the sixth type, psychotic depression. In this, a person experiences depression along with hallucinations and delusions. That is, they hear and see things that are not actually there. Emily, an office worker, is hearing voices and seeing things that aren't there along with severe depression. She feels that people are talking about her and following her even though this isn't happening. This could be a sign of psychotic depression where a person's connection to reality is broken. So friends, these were some major and common types of depression. Generally, you can have more than one type. There is no need to worry about it. If you are still watching the video, my advice is not to miss the next 2 points as they are very important. And if you have any queries or suggestions, please let us know in the comments. Now let's move on and understand the common symptoms of depression. Symptoms 1. Sadness and irritability. It means you always feel sadness and irritability. You get angry over small things and may shout at people around you. This sadness and irritability can make daily routines difficult and also affect your social relationships. Symptoms 2. Feeling negative and worthless. It means you feel negative and worthless. You don't value yourself and think that you are not capable of anything. This thought makes you ignore your achievements and potentials, and your self-esteem starts to decline. Symptoms 3. Memory difficulties or personality changes. It means you start experiencing memory problems and personality changes. You begin to forget things that you used to remember, and your habits and behavior may change as well. These changes can be troubling for you and those around you. Symptoms 4. Fatigue and sleep problems. It means you feel extreme fatigue and have sleep problems. You always feel tired and drained, even if you have slept all night. This fatigue can negatively affect your productivity and daily activities, and you may also have trouble concentrating. Symptoms 5. Loss of interest in normal activities. It means you lose interest in normal activities and don't feel like doing anything. You lose interest in things that used to make you happy. This lack of interest can make you socially withdraw and feel lonely. These were some common symptoms. We have already made a dedicated video on the symptoms of depression, in which we have explained 60 depression symptoms. You can check it out by clicking on the I button or in the description box. Now let's move on to the most important point of this video, the treatment methods of depression, that is, what treatment options are available. So let's start with home remedies. Now you must be wondering if depression can be cured at home? So let me tell you friends, it is possible. You can get better, but if you feel that you are in the initial phase of depression, like feeling depression symptoms for 15 to 20 days or a month, then you can manage it by adopting some home remedies, like healthy diet. It is important to take a healthy and balanced diet. You should avoid junk food. You should eat food that is high in vitamins and minerals. Next, regular exercise. Regular exercise improves mood and reduces stress. Next, proper sleep. It is important to get good sleep. Sleep and wake up at the same time every day. And when you eat a healthy diet and exercise, you will automatically get good sleep. This is very important. Many people ignore it and regret it later. Next, support system. Many people don't share their feelings. Don't tell anyone anything, but you shouldn't do that. Spend time with family and friends, share your feelings with them, and take their help. For example, look at Ravi. Ravi improved his diet, started regular exercise, and started sharing his feelings with his family. This made a big difference in his depression symptoms. Both his health and mood got better. By following these 4 simple steps, you can manage the initial phase of depression. Now let's see the next treatment option, cognitive behavioral therapy, CBT. CBT is an effective therapy that helps to change the way of thinking and behaving. In this, the therapist identifies the patient's negative thought patterns and behaviors and helps to replace them with positive ones. For this therapy, you should take the help of a good psychiatrist. Let's understand it with an example. Charles felt that he was not good at anything, and his negative thinking was having a very bad effect on his life. These negative thought patterns made him feel like a failure in everything, be it his work, personal life, or friendship. The therapist explained to Charles that his thinking that he is not good at anything is just a result of his negative thinking. They gave Charles several exercises and activities that helped him develop positive thinking. Gradually, Charles increased his self-confidence and gave a new direction to his life. Now he was confident in his work and happy in personal relationships. Now let's see the next treatment option. Core beliefs. Core beliefs are those fundamental thoughts that a person has about their self-worth and the world. In the treatment of depression, it is necessary to identify these negative core beliefs and replace them with positive beliefs. Basically, CBT and core beliefs are the same, but you can strengthen core beliefs yourself, which helps a lot in defeating depression, meaning the better control you have over your thoughts, the better you will be able to manage. Let's understand it with this example. If you have believed that you can never be successful, which makes you feel very depressed and you don't feel like doing any work, then this is a negative core belief. The therapist can identify this and help you understand that this thinking is wrong and can help change it by focusing on their positive aspects. Core belief is a very long topic. We will understand it in detail in another video. It is very important to make your life better. Now let's see our last treatment option, medications. Doctors or psychiatrists prescribe some medications that help balance the chemicals in the brain. Do not take medication without professional help. It can cause a lot of problems for you. For this, you should see a good doctor or psychiatrist. They will help you. So friends, these were some common treatment options for depression. There are many more options. We will understand them in detail in another video. Overall, if you want to defeat depression, first of all, make yourself strong and say that yes, I can defeat it, which will bring a positive energy within you. So it's time to end the video. Today we understood everything about depression one by one. I hope you all understood it well. So let us know in the comments how you found this information and what other mental health topics you want videos on. Also, don't forget to subscribe to the channel and like the video. Thank you.